Awesome. Welcome to today's IDRPP's Time to Act Substance Use Echo. I'm Leo. I'm the project assistant for Project Echo here at the Institute for Disability Research Policy and Practice at Utah State University. If you could please drop your name and contact information in the chat, it'd be greatly appreciated. This just helps us network with each other and helps us contact one another if we have an idea or resource we want to share with each other. And also if closed captions do make the session easier to follow, you can go to the More button on the toolbar and you can toggle those on. We are recording today's Echo session just for educational and quality improvement purposes. So when joining and participating in this session, you are consenting to being recorded. So if you don't wish to be recorded, please disconnect from the call now, but we do really want you to stay, so please stay. And participation. Echo is an interactive community. We have our presenters, stakeholders, and community members engaging with one another, whether it's sharing resources or just giving out recommendations on a case. Participants are expected to be engaged in asking questions just during or after the didactic presentation. You're always welcome to drop those questions in the chat, or you can raise your hand during the presentation and we can get that answered for you. Case narratives and case discussions are also just a great way to get support on just a difficult case. So if you haven't presented a case narrative yet, we really urge you to do so. And if you are thinking about presenting a case, make sure you email projectscope@usu.edu and we can get that set up for you. Let's also remember to please protect individual privacy. So we do talk about some sensitive topics when we are in some of these echo sessions. So if you're unsure about a statement or question that you're about to say, you can always reach out to one of our hub members. They can always help you out, and they should have an asterisk by their name. Also, there are three key components to today's echo session. The first is our subject matter experts, which for today will be Ashley. I'm sorry, I definitely forgot how to ask how to pronounce your last name, but Ashley
Yaugher.
Ashley Yaugher, thank you, and Cris Meier, who will be presenting on building strong community partnerships and coalitions. Our second key component is our case presentation, which I actually will be presenting for today's session. And our last component is just that professional networking, which can happen in our breakout rooms or by reaching out to someone in chat. Echo sessions are just a great way to network with others from similar organizations and get some really great ideas. And also, this is just a quick guide on how to rename your profile. You can go to those three dots by your name in the Participants tab. And when you click that, it can give you the rename option. And then this is just how you raise your hand. The raise hand feature is just really helpful if you have a question for the presenter, or if you're in a breakout room and you don't want to interrupt someone, you can always raise your hand and we can get that answered for you. And just for some echo session etiquette, just remember to please respect the presenter by using chat or raising hands to contribute when the presenter is speaking. Let's also remember to please be on mute when not speaking to just respect the presenter's time. Let's also keep our questions brief and on topic as it helps everyone get into the conversation. And just last, we really do encourage you to turn your camera on as it helps us connect over this virtual echo session. And how to get a credit for attendance. Tori will be dropping that survey link to get that credit of attendance, and it's presented in the form of a certificate of attendance. We really value your feedback, and we always do use those survey results to improve just the quality of our echo sessions. And we like to look at the suggestions just to see if we could do any changes to make these sessions better. So we really, really appreciate it when you guys fill those in. And we also have a place in our survey that asks for an email, phone number, and your mailing address. That's just so if you do attend enough echo sessions, we can send you some free swag. And just for the Canvas pages, Canvas is the platform we use to put resources from today's session, the presenter slides, past sessions, and today's recorded session as well. So if you would like access to those resources, just make sure you email projectscope@usu.edu and we can send you over an invite. And just another plug for case studies. It's just another really great opportunity to receive that feedback and just applicable feedback too. Also remember to follow us on our social media pages. We have a Facebook, Instagram, and LinkedIn. It's just a really great way to have some reminders about Echo or just look at some really impactful quotes or resources from some of the sessions. And also remember, if you'd like, you can join our Facebook group just by scanning that QR code where we have maybe some discussions or I just ask some poll questions about how we're feeling about Echo. So Yeah. And I'll hand the time over to our presenters.
Thank you so much. I was scanning your QR code to join your Facebook group, so.
Thank you.
Awesome. Well, thanks for introducing us, and we can also just give a brief presentation. We're thrilled to be talking with you all today about the importance of strengthening community ties and coalition building. Chris and I have given this presentation a little bit different one before. So if something looks familiar, you might have seen similar bits to this before. And just to, oh, if it'll let me go through it, there we go. Just to talk briefly about what we're going to talk about today, we'll introduce ourselves, talk about collaboration and what it means to be a collaborator and how to do that effectively. We'll do some community mapping and defining some coalitions, and then just a quick example from the field, as well as some lessons learned as far as coalitions and collaboration go. I think there's always a ripple effect and things to learn, even if you've heard this kind of information a million times before. I always find little nuggets of new like information or the way somebody says something that will really resonate with me. So we're just thrilled that you all are here and know that you have a whole breadth and depth of background in this area. Just to introduce ourselves a little bit more, Chris and I are both with Utah State University Extension. My primary role is with Extension as a Associate Health and Wellness faculty member, and I serve Carbon and Emory counties. So Extension serves the entire state of Utah. You have a local Extension office in your county. We are very fortunate to have a really great reach throughout our communities, and we provide education that is for community members to build knowledge and improve lives. So if you haven't ever connected with your extension faculty member, I recommend that you do. Chris, did you want to say anything else about yourself or extension or your other college that you were also part of?
Sure. I don't have a lot, but yep, I'm Cris Meier. I'm an associate professor in social work as well. So we have specialists who are within an academic unit who work with extension, and then we also, teach classes and do things with our departments. And we're sprinkled around campus in a variety of fields. My specialty area and with extension is very broad. I just do health type programming, evaluation, things like that. Yeah.
Yeah, we do so much fun stuff at Extension. If you have a question, Extension probably has somewhat of an answer for you, depending on what you're looking for. So my question to get us all started is, are you currently, and they're going to put a poll up for us, are you currently involved in a local prevention coalition? I just wanted to see how many of us on the call already are involved and engaged in prevention coalitions. So if you can answer that poll, and then I'll have them share it once we seem like we have about 18 or so, 15 responses. So are you currently involved in a local prevention coalition? Yes, no, I don't know, maybe.
I'm gonna leave it open for just a few more seconds.
Yeah, perfect. And if anybody clicked like I don't know or right maybe, I'm curious if you want to unmute or you can put in the chat why you said I don't know. Because sometimes we're involved in coalitions that maybe aren't strictly prevention focused. So I'm curious to hear maybe what you're like, maybe it's prevention, maybe it's not.
I'm gonna click share results. Is that
Yes.
okay?
Yep.
Awesome.
Let's share them. So it looks like for the most part, people are involved, which, yay, that's awesome to see that most of us on the call, 73% are involved in a local prevention coalition, 18%, which that means 1 in 5 of us is not. So I'm glad that we're talking about this today and the importance of your local coalitions. I also will have a link and a QR code at the end for you to look up and find more information about your local prevention coalition. If you're like, I don't even know where to start, we've got you handled. We've got that covered for you. And then 10% of us, so 9% said, I don't know. So if anybody is like, I'm not sure, maybe I am, maybe it's considered a prevention coalition, you can feel free to put in the chat or let us know, right? Like this ambiguous, like maybe it's a prevention coalition, maybe it's not. Sometimes there's also other engagements and things that are kind of across that continuum, is what I like to call it, that's maybe not just prevention focused, but maybe focused on recovery, treatment. I don't see anything in the chat. So I'm gonna keep us moving, but maybe somebody's typing something. But thank you for sharing the information on that, Leo.
Of
That's really
course.
helpful. And so when I'm talking about the continuum, I love this model, the Institute of Medicine's continuum of care. It just speaks to me, like the way that it looks. So it kind of goes from this prevention side on the left all the way across to the recovery side. And it's really a continuum of all the areas of care that people need when we're talking about substance use and substance use disorders. So, right, there's kind of health promotion that targets everyone and everybody gets some of that information in our society. And then there's prevention where it's universal, everybody's getting it. It's selective, right? Where a group of people are getting it, like at a school, or it's indicated. So it's a group of high risk youth or people who are indicating that they need this programming on prevention, whatever that programming may be. So that's kind of the prevention side. And then if you move slightly over on this continuum, right? Because it overlaps. There, people can go kind of back and forth on this continuum. It's not mutually exclusive. You move towards treatment. So that's when somebody's actually identified and being treated in mental health treatment, behavioral health treatment, right? Substance use disorder treatment. And then there's like a standard for, right, known disorders. Cognitive behavioral therapy, a lot of the time, works really effectively for anxiety, depression, as well as substance use disorders. There's also acceptance and commitment therapy. So, depending on what people are experiencing, they're going to be targeted for treatment. And then once you are successfully completing treatment, and right, that again, you can continue treatment your whole life. You enter recovery where you're no longer using substances or you're in compliance with your long-term goal, which is reducing that return to use, right? Or managing that use of substances. And then there's aftercare. So that includes things like rehabilitation and continuing what is effective for people to live their best lives. And I think this continuum is just really nice way of looking at, there's a whole spectrum of things that people need. It's not just one thing, and it's all interconnected, and you can't necessarily have one all by itself. So when we're talking about this continuum of care, I like to start here because it's really helpful to see maybe the person who's like, I don't know if this is a prevention coalition. I would argue that every coalition that has a goal or a task force is also in some way focused on preventing, right, that upstream or downstream effect of whatever they're trying to address. So whether it be fentanyl or overdose deaths, they're still also wanting to stop some of that negative behavior or negative outcome, right? Which would be the overdose loss of life. So I would argue that if you're on a task force, you're like, I'm not sure where to put this. It's also prevention focused because there's this whole continuum here that we're all a part of. I don't think there's probably anyone here on this call that's not part of this somewhere. So we're glad that you're all here. And multidisciplinary teams are the best. We're going to talk a little bit about why you want people with different backgrounds and experiences. But just to start us off with taking that very first step, it's important to also, while we're thinking about these things, know your community resources, because actually knowing that helps empower people and empower communities to engage in activities and empowers people to take their first step towards recovery, take their first step towards, oh my gosh, my child is vaping. What do I do? Right? So it really empowers people of finding the resources where they need them and then using them, right? Because you can't use resources if you don't know what they are. So that's kind of the first step of all of this is knowing your resources. So one of the things that we like to talk about a lot, and kind of the big goal of today is to talk about collaboration. Again, we're going to say a lot of words and things, and I'm going to leave you with a really fun worksheet, and we'll put it in the chat in just a moment. But one of the keys to having a collaborative team is I think having multidisciplinary teams is the best because you get people from different areas, different backgrounds. My background's a clinical psychologist, and so I love working with people who have different backgrounds. Like Chris is a social worker. We bring different ideas and the ways that the world is formulated from our career paths and from our theoretical underpinnings, right, to each task and activity. And I think that's really helpful. But then you also have to have a shared team vision. So, what are the goals that your team is working towards, or your coalition, if you're talking about a coalition in this case? And then you want regular and frequent interaction with your team. So that can be once a month, it can be bi-weekly. Really, it depends on your team and the needs. Like, are you trying to get a task done right now? Are you planning an event? What are you doing that needs to get done? So it depends on that. And then also having an establishment of team member trust. So don't forget any of these like really important keys. When we're talking about collaboration and teams, it's important to trust one another that, yes, I know I told this person to do this part of this task, and I know that they'll get it done. I trust that they know what they're doing. I trust that they'll get it done on time. But also knowing that your team thinks the best, right? Or like assumes the best of intentions, because sometimes things happen and life happens, right? And so if something doesn't get done or something is needed and you're like, gosh, I haven't heard back from them, it's okay to reach out and say, hey, what happened? Like, do you need some help? So assuming the best of intentions, but having that really strong bond and trust of your team is important. We're going to introduce the SAMHSA Strategic Prevention Framework, or SPF, in some of our examples. There's a lot of coalition frameworks. One that you probably have heard a lot about is the Communities That Care model, the CTC. That's what most of our coalitions in Utah are using, and a lot of my local coalitions use, and it's just a really great tool of kind of formulating how to think about each issue and risk and protective factor, and then building your programming around that. But all of these are going to do the same kind of thing. So this kind of shows you that strategic prevention framework when we're talking about coalitions and building those and that collaboration. So you start with assessment, right? You start, what is the problem? What are the things that we want to address? In the Utah, we have the SHARP survey, which is an excellent tool to look at what are the risk factors in my community and what are the things that are a protective factor for my youth and how can we build those up? So you start with assessment, then you go to capacity. What's being done? What do we have the capacity to actually do in our community? You start planning and then you implement the plan, right? So you actually have to go and do the thing that you proposed that you will do. And then you evaluate it. You say, hey, how did that work out? What went well? What are areas of improvement? I don't like to say fails. Like, where did I fail? I like to say, what did I learn? Like, how can I improve? Where is something that I can learn from? And in prevention, the sustainability is really key here, and building that in a community to maintain those positive prevention outcomes over time is the goal. So this is really an iterative process. Think of it as like a wheel. So you continue to go around and around and around this wheel. So you evaluate and then you assess again, and then you assess capacity and you plan, and you continue to do these things throughout to spread that prevention message and get the effective programming out into your community. So that's really, if you want to think about it that way. And also keeping in mind, right in the middle, the sustainability and cultural awareness of what your community is like. Yeah, Chris, go ahead.
What I was going to say too, not only is it like cyclical and you go around that process multiple times, you can also have to jump backwards, right? So you make
Mhm.
it to the planning phase and you go, oh, shoot, we need to go back to the capacity phase or the assessment and try again. And so it's not always like you get to always follow the cycle cleanly. Like real world stuff, right, is messy and we're jumping all over the place.
Yep. Yeah, excellent point. Yeah. Okay. So I'm gonna, do we have a question or anything in the chat? No. Okay. This is just really the basics of collaboration. And then we're going to start, I'm going to actually put in the chat right now the link for you all to, you can click it and we'll tell you what it is in just a minute. And we'll also have a QR code in just a second for you to look at this. But if you want to follow along kind of with me as I'm going through these, you can see them there. So the first SPF step when we're talking about collaboration is assessment, right? Like I said, then you go to capacity, but there's always opportunities for collaboration along each of these steps. So I want to give some examples in each one. So for step one, assessment, you can look at where you're identifying, prioritizing local prevention needs based on your data. You're using SHARP data or whatever data you have access to. There's several opportunities for collaboration just at the assessment phase. So you can identify and obtain data on local prevention needs, manage and make sense of that data, and then share and receive feedback with people based on your findings. So you could even engage evaluators or graduate students or master's level students, undergraduate students at a local university to help look at some of that assessment data. So that's just one example of a way you can ask for additional collaborators. So don't be afraid to reach out to local colleges, universities. If you have one locally, that's an excellent tool, or extension, because extension is another opportunity to collaborate on analyzing that data. They're often doing that too for their needs assessments. So, right, many hands make light and effective work. Number two, capacity. So communities building local resources and readiness to address those prevention needs. You can develop or strengthen prevention teams. Like, where are the gaps in your team, right? Make sure that if you're doing any kind of programming, that you have the people that you're doing the programming for on your coalition. So if you're targeting youth, make sure you also are asking youth how things are going and what they like to do and what they like to see. If you're targeting people in recovery, try to make sure to have people in recovery represented on your coalition as well. So just thinking about those gaps and where do you need to fill those gaps to make sure that you're having an effective message for your population. You can increase readiness of stakeholders to address priority problems and contributing factors, promote that broad participation in community prevention efforts. The more people you have, the broader your message can spread across the community and really ripple out to everyone. An example in this step of capacity building is to work with an editor of a local newspaper to highlight community prevention efforts in a monthly news column. That's one that's not too difficult to do, and community newspapers are often looking for articles and segments to highlight. So that's an option of finding somebody to collaborate with that could even benefit your entire community each month in a way that maybe is a little different, right? Or social media and finding ways to get that message out on social media with different collaborators each month. And maybe you have a partner highlight each month where you're like, hey, this person does this really cool thing in our community. So that's just another, oh, where are my slides going? Go, slides, go. So the next one is planning. So communities developing strategic approach to addressing those prioritized needs that you've already identified, including things that are associated with them. So positive protective factors and also risk factors, and identifying the ones that you want to address. So prioritizing those. You can develop a logic model. Extension's all about a logic model of finding the problems and the relationship between the problems and the interventions that you want to select and the expected outcomes, right? Short term, medium term, and long term. Like, what are you expecting to see if this goes to plan? And then selecting those appropriate interventions and building your plan, sharing and receiving feedback on that plan is really helpful, especially from the groups that the plan is for, right? So if you're like, hey, kids, do you want to go and do 10 hours of structured activities after school each day? And they're probably like, no, maybe like 1 hour, right? Once a week would be okay. Youth are very busy. Like, they have a lot on their plates already. So make sure you're talking to the people that you're wanting to engage. So an example at the planning step is if your community has a large immigrant population, for example, engaging representatives from that group to better understand factors associated with their needs and things that they're wanting to see will help prioritize those problems for, right? Like, what do they need? Do they need another food bank option? Do they need additional support in childcare, and finding that out for them as well? In step four is the implementation step where you're actually doing it, right? You get to implement it finally. You're delivering those evidence-based interventions that you can find on the Blue Book website and page, right? So you've probably heard about that before, but there's lots of really cool lists of interventions that have gold standards. And there's also evidence-based things that are evidence-informed that you can find on there as well. So finding the right fit given your local conditions and local priorities and your local funding, right? Some of these things cost money to get trained on and to actually deliver. So keeping all of that in mind, you can raise community awareness of those problems. You can make sure that the interventions are implemented with fidelity, so the way that they are meant to be implemented, so they have the outcomes that they say that they will have in the programming based on their testing. You can adapt them based on the need and cultural relevance. I know a lot of rural areas, we have a very different experience than urban areas in the state of Utah. So making sure that your intervention fits your rural versus urban needs, depending on what that might look like. And then building that infrastructure to support implementation. So an example here of where you might find a good collaboration is working with members of the business community actually to implement a responsible beverage server training. So you could even find people that need to learn, oh, how am I being responsible? Oh, I'm not supposed to serve to people under 21, right? So, or even doing liquor store checks or working with people to do that as well, tobacco stores and selling places to make sure they're selling to the appropriate age group, right? So kind of learning those different things. And then step five, one of Chris's favorite steps is evaluation. So make sure that you evaluate the process and the outcomes And do they have the prevention outcomes and interventions that you are trying? Did it work, right? So did it have the outcome that you expected? Opportunities for collaboration again, so you can plan and conduct culturally relevant and technically sound evaluation needs. So you're not going to be asking fourth or fifth graders super complex questions if they're doing your programming. You might have smiley faces like, did this work? Did you like this program? Smiley face, yes, right? So thinking about who's actually taking your evaluation as well would be helpful here. Identifying which prevention interventions are and also are not working as intended, and then sharing lessons learned to make sure that people are using those evaluation findings. So an example here could be involving members of a focus population in the development of your evaluation tools. So maybe some youth could tell you some important questions that they think would be relevant on your evaluation method after, right? So did you enjoy this program? Yes. One thing that we've found is youth like to make friends at these things. So we've actually added to our couple of our programs, like, did you find a new friend or make a new connection in this youth club that you did, right? So that's actually kind of feedback from the youth that we've incorporated. Okay, so that's a lot of information about the strategic prevention framework. This is a little bit different, but on the same line of collaboration. So collaboration is a big word, right? Like, what does it mean to be a collaborator? It can mean different things to different people, and that's okay. So, collaboration, depending on your needs, is different. So, there's a level and kind of a continuum of collaboration, ranging from networking all the way up to full collaboration. So, networking is more where you're partnering to share information and talking together for a mutual benefit, right? We all have networking partners. We put their logos on our flyers, we kind of share the word of mouth, right? That's networking. Cooperation is where partners support one another's prevention activities, but you don't have a formal agreement in place, right? So you don't have like an MOU necessarily, or they're not signing anything that says they're part of a coalition necessarily. So that is where they are maybe sharing your information out, or you're working together to develop a product like a resource booklet and you're cooperating together. Coordination, moving up one more, is where you're engaged in those mutual projects and initiatives and modifying your own activities to benefit the whole. So, say an identified need in your community is vape prevention, but there's already somebody doing vape prevention, and your coalition wants to partner with them to bring them more into the work that you're already doing so that you're not duplicating efforts, you're just enhancing both of your efforts, and then you can focus more on alcohol prevention, per se, right? So making sure that you're using all the parts of the whole, you're both working together to get a larger outcome together, right? But you're kind of doing your own programming, but you modify to benefit everyone slightly, modify slightly. And then full collaboration is kind of the last one over here. It's you when you have a more formal memorandum or formal agreement in place. Partners are working towards developing enhanced capacity to achieve that shared vision. So everybody's working on the same kind of thing to reach the same goal, right? So you're all engaged in prevention activities and learning how to do the Strengthening Families program together, say, right, as an example, and then going out in your community, regardless of which organization you're from, but you're all delivering that class together. That's full collaboration. And so that's kind of another example. Okay, here's the activity sheet that I put the link to in the chat. If you would rather scan a QR code, this one is just kind of walks through exactly what I just walked you guys through, so you don't have to relearn any of it. But one thing that we like to do, because we're talking about collaboration and learning to be full collaborators and talking about how do I do this, I like to give people just a second to look over this activity and see, right, who do you already have in these roles, right? Who is the person that you would reach out to, or who are the people or the groups that you would reach out to, and how, right? How would you start to go about doing each of these steps? So you can kind of think about that and put them in for each of these segments. We're not going to like check your work, right? But we're going to send you into breakout rooms with that in mind. And there's going to be 3 of you in each room, or 4. We want you guys to introduce yourselves with your group and who you're with, your current collaboration efforts, maybe just 1 or 2. And if there's someone in your group that maybe could help with one of those steps on this slide, right? So oh, you're a really great person in assessment, or you are good with implementation. I need to get your email. Um, and then talk about maybe how collaboration can facilitate or improve the process of meeting those shared objectives or your current objectives that you already have. So introduce yourselves, talk about your current efforts of collaboration, why collaboration is important, basically, and then anybody in your group, just keep in mind as you're talking, like maybe they could fill one of these needs. And we're going to put you out into those groups.
Yes, sorry, give me 2 seconds.
Oh, Tori's on it, you
And
guys.
then, yeah, I will move everyone out.
And I was like, this is going to be at the middle-ish, end-ish of the president. So I
Hey,
didn't tell her an
no, it's
exact
perfect.
slide. Okay.
I'm gonna send those invites out, so everyone just watch for your invite and then click on it, and you will be in your breakout rooms.
Okay, welcome back. People are trickling in. I always like breakout rooms where you can say hello to people. Hopefully you all got some new collaborations. Um, and as people are kind of coming back, if you want to think about, what level of the SPF are you are already at, or maybe you're thinking about starting at the first step, right? So kind of assessment and thinking about things. And if anything was maybe surprising or you learned anything new about involvement and collaboration while you're talking with other people. So welcome back. I have some of our questions on the slide. I'm going to lead people through. I'm just waiting, like, because we still have a couple in the breakout rooms, right? Or is everybody back?
No, they should all be back.
Oh, okay, perfect. I'm like trying to watch the number of people coming back in, and I can't see everybody in my.
You are all good. Sorry, I should have told you.
Oh no, that's okay. We always lose a couple people when you do breakout rooms, right? Like they're like, no breakouts. So does anybody want to share anything that maybe they learned or a new connection that you made or anything about the SPF steps that you're at? You don't have to formally answer the questions that are on the screen, but anything that stood out in your breakout rooms? Is it fun to chat with people? I always think it's fun.
I think it's fun to chat with people too, honestly. Sorry, I saw that Lindsay raise her hand, but I'm just gonna go really quick. And I know that I spoke with someone related to assistive technology and someone also from the health department down in South Salt Lake. And I just think it's really great how a lot of collaborations can form from some of these coalitions and just some of the things that you wouldn't expect. I mean, my background is mostly in sociology, and now I mean, I started working a lot around early intervention providers, so I think it's really cool to see how they can collaborate or how some of the concepts from sociology can even relate back to literal early childhood prevention, which I didn't really think they could, but they can. So, yeah, I'll let Lindsay go.
Absolutely. Yeah, go ahead, Lindsay.
Yeah, so I think that one of the things that I know you mentioned, like it's the importance of having people from the group, right,
Hmm.
to lead those groups because they know they're if it whether it's region wise or somebody with lived experience because they've got that connection, right, and they know what's going on in their location and what needs to be done in that area. But also the importance of instant like paying people right for their time and for their effort is so important, and paying people with lived experience in a way that honors their lived experience the same way that you would honor like an educational background
Hmm.
is really helpful.
Yeah, excellent additions and points and incentivizing people. And sometimes that looks like funding, right? And like, or sometimes you could pay for them to go to a conference or to get some education. And sometimes you can give them, right? Like people do this for their job a lot. So I know a lot of us get our own incentives from doing that too. So that's a really good point because making sure that everybody gets something out of it.
Also, not putting any research behind paywalls.
Yes. Yeah. Making sure the research is accessible. Yeah, good points. And then in the chat, some incentives. Yeah, no, that's excellent. I'm going to keep us going just to make sure that we have plenty of time. So we talked about the SPF model a little bit. Now we're going to talk more about collaboration levels. You can kind of think of this for yourself, but I'm going to break you guys out so you can chat about this too. And you have that link to the document if you want to download and go through this more extensively on your own. But think about kind of where you're at, right? You can do a self-assessment of where am I and who are my partners on each of these, and then what are my next steps? Like, who do I need at each of these levels to gain that traction or reach that prevention that I'm hoping for in my community, or even start finding new prevention activities or working with somebody new, and why that's important for families and early childhood, right? Interventionalists, because the more that you are connected and the more that you do, the more resources you're aware of and can spread out in your community and with your clientele as well. So I think that's really helpful to have. So you have this activity, but we're going to send you out into breakout rooms one more time. And I don't know if you can, Tori, just do like a different group of people so new people can, or just randomize it. Maybe some of the same people will be in the same group. But if not, that's fine. You can just introduce yourselves. If you've already introduced yourselves, you don't have to do that again, but kind of talk about any of those other levels of collaboration that maybe you already have really down, right? Maybe you're really good with networking and you're like an excellent networker, but how can you go up to a little bit more engagement from your partners and a little bit asking them for a little bit more, but also giving a little bit more in that interaction. So maybe talk about who you can collaborate with and using those levels. So brainstorm some new collaborators in your group. Are you ready, Tori? Did I put you on the spot again? Okay.
No, you're good. I just send out the invitations.
Okay, cool. Welcome back, everyone. Sorry to end your discussions. I know you could probably talk all day to each other when you get going. And just by a raise of hands, right? Did anybody find a new collaborator in your group? Like, was that a useful bit of time? Like, raise your hand or do the hand raise tool or new collaboration ideas? Yeah, good. And you can even unmute if you want, but I think we're okay. Awesome. We're not going to make anybody talk that doesn't want to talk about anything. But this is just a list of additional people that if you don't have on your list of people or your groups or your collaborators or the people that you're talking with on a regular basis, here's some people that the Communities That Care and the SAMHSA Strategic Prevention Model recommends that you have on your list. So parents, faith communities, resident leaders, social services, business members, community action organizations, education, K through 12, and also university level, public health, media, economic development, youth serving organizations, right? So other organizations that serve youth, justice systems, youth themselves, elected officials, community law enforcement, other people that are right that have lived experience with whatever the issue is that you're addressing. All right, so I'm pass it to Chris. I'm going to stop talking for a little bit.
Thanks, Ashley. Yeah, and I think the this discussion around like a new collaborator and finding new people to partner with is really important. And we're going to talk about community mapping in a second. But last night I was down in Salt Lake and was doing sex ed with like 50 middle and high schoolers. And I was talking to the organizer afterwards of it from Salt Lake, the real what I can't remember what they're called, but I was like, who did you have come do these in the past? And they're like, they told me who it was. And they said, you know, the funding landscape has changed so much. The people we've collaborated with in the past, we can no longer use them because they just don't have the funding, they don't have the capacity, they don't have the resources. And so our collaborators that we've had maybe aren't there anymore. So it's really important to like always be looking for new friends and new resources because in the last year, the funding landscape has changed so much that those people we've worked with and relied on for maybe years and years are no longer there or just don't have the capacity to do that anymore. So it was real eye-opening for me last night to be reminded of like they're excited that we found each other, but it's still like, oh, it's a bummer you couldn't use that person you've always used, you know, but they're having to be creative and find new collaborators in order to do their after school programming and stuff. So another kind of tool you can use, we're not going to do it today, is community mapping. Ashley, going to go to the next slide. Community mapping can be a visual kind of process that you can do. And so the one on the right is pretty complicated, but the way we like to do it, because it's a way to assess kind of the networks. So technically this is a social networks analysis, but it can be very simplified compared to what it is here. But like each of the little squares in the diagram on the right is an org, and each line with there's an arrow, you just can't see it very well, shows the direction of referral. So is it going, are you referring to them? Or are you getting referrals from them? It's an interesting way in your coalition or organizations to see who are a network of people? Like who are here? And then like when we see some of these people on the outside, like to the bottom right of the figure, there's like these single ones that have one line going to, one of the other orgs. Well, they're not centrally located in the coalition because this was actually a coalition that was mapped. And so these are outliers who aren't part of the coalition, but maybe interact with one of the orgs, but they're not well situated with the others. So it's like, well, has anyone invited them to come to our coalition? Has anybody, why are we all not collaborating with them? Like the really mapping out what your community resources look like and who else can be integrated into your coalition or collaboration is a really kind of cool way to think about what's going on in your coalition. So I encourage you, again, this one on the right is more social networks analysis, but you can do more of a basic one where you draw this out yourself. There's free mapping software where you can do this online because community coalition mapping and resource mapping gets messy. So it's nice to use some of these free programs online. And I'm happy to share what those are afterwards. But it's a good tool, especially if you're stagnant in your coalition and you're like, we have 73 members, but 25 don't come. And like what's going on here? Why are we losing people? Are we losing people because the funding landscape? Are we losing them because they're engaged with other coalitions that are more active? So anyways, it's kind of a cool way to think about like coalition membership and collaboration. So actually going to the next slide. So you guys here, I think with our remaining hardcores are already coalition masters. Like there's a lot of youth prevention folks in the chat that I saw that was their position. We're just going to talk really briefly about some basics of coalitions. So some of the things you're going to be like, oh my gosh, I know this, but I also think it's good to constantly go back and reassess and intentionally do some things that are like naturally done in coalitions, but do them in an intentional way so that the coalition is performing how it's supposed to be performing, doing what it's supposed to be doing, things like that. So real basically, right, as you guys all know, coalitions are a group of individuals, often a group of someone who comes from an org, who represents an org, or several people who have some kind of common interest. And the hope is that the coalition has some kind of shared goal or mission that's driving them through their work, right? So next slide, Ashley. So why do we need coalitions? You guys know this. So, we see this a lot in social work where it's like there's competition, right? For like some types of things, like especially in rural communities, it's like you're the one mental health authority, you're the one person who does domestic violence. But at the same time, like we all realize in our practice that we can't solve these social problems our clients are experiencing because we can only do one sliver of the larger problem, right? This is where coalitions and collaborations are so essential, is we can work together to help address that community or social problem in a way that one org alone isn't really able to do it because of capacity reasons, because it's just not their area, things like that. And the nice thing about coalitions, as you know, and I'm hoping all your coalitions do this, you should have a variety of people from a variety of sectors there, right? Because when we think about like things like basic needs, well, that's a lot of different sectors that need to be in that conversation of how do we help our community members meet their basic needs to make sure they at least have those basics, met. So next, Ashley. So 1, 2, 3 clicks, Ashley. So there's a couple of main features, probably more clicks. I don't know how many clicks are on this one, but if coalitions, I think the most important one on here to start with is that it's grounded in community. It's not grounded at the institutional level, right? So it's like the idea of grassroots efforts and things like that, but kind of the structure and the work that's being done should be a bottom-up approach. Should be grounded in community needs, not grounded in organizational needs, shouldn't be grounded in institutional needs, things like that. It's really important that it's driven by what we know about our community, what our community needs, right? We want to make sure that the task is developed in a collaborative way because, some coalitions do not succeed. I don't know if you've ever been on those coalitions where absolutely nothing gets done. Like we have this in extension. I'll just be honest. We go to these work groups and we're like, oh my gosh, when is this over? And we go and then we stop going because like we're not getting anything accomplished. And that happens to coalitions as well. So we need to have a really good structure to our coalition that has shared understanding of why we're here, a shared goals, and then working pieces that help us work towards our goals so that we see movement to addressing the social problem instead of just we meet once a month, every month, there's a speaker, that's like, going to a meeting. It's not what the coalition should be doing, right? So go ahead and go to the next one, Ashley. So the one of the big things we have in social work that we talk about are collective impacts. So hopefully you've heard of those before. And we really try to push and encourage coalitions and collaborative type, groups like that to consider collective impacts. So it's a good way. So say like our coalition is focusing on improving protective factors to like reduce, mental health, like mental health disorders among youth or something. So what we would do is we would kind of pool our resources. So this is what my piece is. This is what your piece is. We're making it so it's a multi-level or multi-component type of a intervention. And then we're going to share a measurement tool so we can all see collectively how the work we're doing has improved that outcome for the population we're trying to target. So the tricky piece is getting everyone to use that collective impact tool, because when in a lot of coalitions that I hear, measurement and evaluation is a problem, right? Like we don't always want to share, we don't use the same questions, we don't use the same level of measurement. It can be tricky. So when you can develop some kind of, hey, we're all gonna agree to put these three same questions on our survey. It's a good way then to be able to show collectively across our group, this is what we're seeing growth-wise in our clients. So another great thing about coalitions, right? It helps kind of reduce those barriers of like not being sure how to, be friendly with this other group that's doing something maybe similar to you. And there's been competition in the past. So it helps try kind of get us to know each other better and then helps us understand what each org does. So we know like, hey, I know that, we don't have someone that specializes in, sorry, I'm using mental health examples. I know this is supposed to be substance use, but like I think about like eating disorders. So when I got an eating disorder client, I was like, oh, I have a friend who can help you. I cannot do that, right? So really trying to figure out like what other providers are good people in the community that you can, do hard handoffs to. It can revitalize work. So sometimes we need to reinvent our coalition, start over, change the name, keep the topic the same, something, but really it can help try to continue towards those community goals. And it can work on some kind of community-wide initiative. So next. All right. So I think the big thing for coalitions, so when we think about our own, like our prevention specialists are here, and we think about the work we're doing, like we can only do so much, right? So the idea, again, going collective impact wise, is when we're doing coalition work, it should amplify whatever type of intervention we're doing. Because not only are we working with others to improve that outcome, but we're also able to like hit it from different directions, right? So it's called a multiplicative effect. So it should amplify the effect of the intervention on your population. So, and also, I think the hope is that we're creating long-term permanent societal change. Of course, we're seeing with policy changes how drastically that can affect things. However, again, if we're doing more of a grassroots, community-led, community-driven coalition effort, that you're hoping that could protect against some of those things that we've seen happen because of those policy changes, both in the state of Utah and nationally. Next. Sorry,
Yeah.
Ashley, it's you again.
It's me again. No, that's such a great point, Chris. And I love the chat. People have been saying this is so cool because it gives me different ways of thinking about and talking about some of the work I'm already doing, right? And like slightly different terms and a way of viewing it. And I love these presentations for that, right? You might be a subject matter expert already in some of these things and you know your field so well, but learning different ways to talk about them is so helpful. And then another comment was, right, collaborative. Work and collaboration actually helps you get grant funding. That's like 1,000% true. So they always want you to have collaborators and listed people who are involved. So that's just a really another incentive if we're thinking about reasons that are not just right creating positive social change, but there's also funding and other things that are connected. So this is just a quick example of a local coalition that I run actually, and I'm not going to spend a ton of time talking about the Carbon and Emory Opioid and Substance Use Coalition, just that I built it off of the Strategic Prevention Framework. It was a need in my area. There was only one other coalition at the time, and they were doing more prevention explicitly, like only focused on youth prevention activities. And I was like, well, what about this whole continuum, right? So we kind of created this to include every single entity in our communities that we could think of. So courts and people in recovery, people working on prevention. So all of the prevention coalitions are also part of this coalition, and just kind of coming together once a month to talk about how can we better collaborate, break down those silos, talk about what we're already doing, and then help each other ripple that across the community, right? So that's really the goal of this coalition is not to like reinvent the wheel, but rather to highlight and share what's already being done and done well. So that's the goal. We do monthly meetings where we talk about those virtually. We have this is kind of some outdated information. We have, I think, 275 email subscribers now. So even though we traditionally have about 20 or more people on each month, there's over 250 people getting these emails, which also include all the flyers and activities, and then they share those out. So you can see how it starts to like ripple information across, even with just sharing like a newsletter almost of what we've been talking about. And we do events, and we also have a lot of positive feedback. This is one example. I do an annual feedback just from the coalition, and just it's really nice to see that people are appreciating the coalition. So I think some satisfaction surveys are always helpful on your work that you're doing, whether it's coalitions or clientele, making sure that you're getting feedback on a somewhat regular basis to see what's going well. What are the gaps? I always ask, what are we missing? And one year we talked about building a newspaper column, which was actually one of the suggested things in the SPF, and we've done that now. It says 75. I think we're up to 80 because I updated this a couple weeks ago. But we do every month a Little Cities of Hope article about various topics. This month is all about why and how prevention works. It's going to be published soon on ETV News, and that goes out to over 10,000 people every month. And so that's just reaching our entire community in a print and online method. So this is a really effective way if you want to share a message. They call them press releases now, right? So if there's something helpful, we try to have an educational component to it too with our articles, but just getting that information to everyone, because why are we keeping it just to ourselves in prevention? Like, we want everybody to know this information. We also developed resource booklets that we just updated again as well with the help of our coalition members. So making sure that when people are ready to take that first step and are looking for resources, there's a book for them, and it's online, it's updated frequently, and also I print them and we give them out at all of our events. We give them to all of our prevention coalition partners. Anybody who wants books, we give them to them, like stacks and stacks of books, because I shared this at the very start of the presentation. You can't use resources that you aren't aware of, right? So making sure people know your resource. We have a lot of Take Back Day events. We do the annual A Light to Remember event for Overdose Awareness Day. We try to hit prevention, overdose awareness, Narcan trainings, really the whole spectrum of things to engage as many people as we can. And if you don't know, Take Back Day is coming up in a couple of weeks. Ours at Carbon and Emory is the 18th, but everybody else's is April 25th. We just had another event, so we bumped it up a week. Why not? We do education events and where we talk about various things, mostly breaking down stigma and making sure that people are a safe place to talk to and can know where to turn. And when they do turn there, they are greeted with positive, affirming recovery language, right? So talking to people instead of saying the word addict, using a person with a substance use disorder, which I'm sure you've talked a lot about in this ECHO series and how important that is, especially for that first person who's seeing people, a provider or a therapist. The way that we talk to people is really, really important in bridging that gap to where they're not sure what to do or where they're first getting into treatment and taking that first step. So you can be a positive influence. We've done several dinners. This is just one example. We give them so many resources that people are like, whoa, this is a lot of stuff. But we wouldn't be able to do all of this without our collaboration, because in here you can see, right, we have people from Four Corners, we have people from the state Stop the Epidemic and the Poison Control Center. So making sure that you have collaborators also helps to fill your swag bags and get their information out. So, right, it's really that collaboration that is really helping everybody out as well. We did a marketing campaign, which was so fun. We actually put these on billboards, and the one on the left we put in postcards to every mailing outlet in Carbon and Emory counties. That was a fun one. Learning experience for me about making sure that you work with the right people that know all the mailing addresses in your counties, and getting that information out there about taking the first step. No two paths are the same. We had people not only in the recovery community, but also law enforcement, right? So making sure that we're talking about law enforcement and working with them. They're just like the best. At least two of these people actually mentioned law enforcement as their direct help and their first person that cared about them, that got them into their first step of recovery. So it's just an amazing thing to like highlight and share. And it feels really good to share some of these positive success stories. These were on billboards in Carbon and Emory. They were digital billboards for several months. And we then gave people thank yous for engaging in that. So this is another thing that they recommend, to thank your coalition members or thank your team members, and make sure that they know that their efforts made a difference and their contributions made a difference to the people that they're serving in their community. So it was really nice to be able to give back and to say thank you. Some key takeaways. I'm sorry, you guys. I said I was going to be done at 5, but it's 1:05. So, or 1, I mean. So if your coalition works, I'm going to let Cris kind of talk through some of this, and we'll talk about other key takeaways.
Yeah, the hope is, right, like with coalitions, and if you're doing a good job collaborating, you really want to see like amongst your people that there's a sense of community, right? People should be wanting to come to the coalition meetings. They should be excited about it. It shouldn't be like, oh man, I have that meeting today. Like you doing, whatever you can do to increase that sense of community that makes people want to come, right, is really important. And how do we support each other and share with each other, things like that. Um, I think the big thing that I see that's related, so I don't know how much you guys probably don't care about Robert Putnam, but civic engagement has been a real issue in the last, 40 or 50, 40 years, I think, probably. I don't know. I'm getting old, so my math isn't so good. But really, we've really seen this whole shift where people are participating in everything less. They don't go to church as much. They don't do civic engagement with like political things. There's just a real reduction in that kind of process. And so really you'd hope that because people are participating in the coalition and people are seeing the benefits from the coalition or outcomes in the community, the hope is that people are more involved in their community and maybe more civically minded and wanting to give back and do things in the community, right? To continue to grow our community and things like that. So anyways, the community is then more prepared to address new social problems. If you've tackled one where you feel like you're making grounds and another one appears, could there be a different coalition or different group that's working on it? And maybe we empower them and, revitalize them and encourage them to work on that. And hopefully, there's social cohesion amongst the groups who are doing this work. Because, right, you don't want the sense of competition. And it's really hard in rural communities because there are some issues, right? When there's only so much money that can come from public health. There's only so much money we can get. And so there's some competition, and you really would prefer that people instead of are more cohesive and working together. So next, some challenges to keep in mind to successes is, making sure that whatever resources are related to the coalition are managed in an efficient way and transparent. So if there is a budget, is there a treasurer, using some of those basic groups rules, right, of like structure and stuff for a coalition. Making sure you have the capacity to adapt to the structure to new needs. So like, for instance, you guys probably use working groups or like small, there's probably other names you use for them, but there's 6 of you that work on the evaluation. There's 6 of you that work on this other thing. So like, with our current structure, will it work if something else pops up to have people join that group to work on, right? So making sure you have a structure in place, because when there's not a structure in a coalition, that becomes problematic as far as moving forward with the goals you're trying to work on, right? Um, for sure, again, this is a groups thing, but create a system for conflict resolution, because there will be conflict in the coalitions. It happens, even when everyone's playing nice. So what kind of like written out policy do we have for our coalition, or what kind of structure are we going to use for those? Like how does someone come with a complaint to whoever's leading the coalition, and then what's the process that's going to be followed? So having something like that laid out is actually really helpful in case something does come up. And, leadership is tricky, so it's really nice if it can be a revolving position that is either elected or people volunteer or something, and that there's a set cycle. So kind of like with the board you'd expect, right? But making sure that that leadership is distributed so that it's not always like, oh, well, that agency has always been in charge, that kind of a thing. Just some tips for coalition success. Let's see. I'm trying to see which ones are more worthwhile to talk about. Yeah, I think again, having that structure in the coalition by having protocols is really important. So making it clear for new members, like how this coalition works, things like that. The other thing I think, and Ashley talked about in her examples, which was really great, was increasing the coalition's visibility. Because in some ways, sometimes we have to like gain a like reputation of our group and the work we're doing. And the more we have a reputation that's a good reputation, and the more people know that we're doing this work, they're going to want to partner and we're more visible in the community, right? And they're like, oh, I've heard of that prevention group. They're great. And then I think it's like reducing barriers to participate. So, some coalitions do really encourage like people, stakeholders in the regular population to participate. A lot of coalitions I've gone to are heavy, heavy on orgs, but like, maybe once a quarter, you want stakeholders to come and so that they can hear what you're working on and they can give you feedback and also promote ideas for new things that are needed. So really thinking about how do we decrease participation? Go ahead, Ashley.
Yeah, this is just the slide. If you don't know who your local prevention coalition is, I encourage you to check them out, look them up. This is the Utah Prevention Coalition Association's website, and they're just such a great group to work with. And I just, again, like collaboration is so helpful, and inclusion enhances well-being, resilience in our communities, and the vitality of our entire community, as well as the effectiveness of our programming. Strong communities reduce stigma towards treatment and bolster prevention and empower people in recovery. So you really hit that whole continuum when you're engaged and you're building up this process. I like to always end by saying prevention works, treatment is effective, and recovery is possible. So there's hope along that spectrum every step along the way. Some lessons that we've learned is making sure you include people and they know their role, making sure that there are goals that you have, measuring your outcomes, and having that definition of your coalition can be really helpful, because defining each thing and giving people purpose and engagement and accolades and recognizing their efforts really lights the fire under them and gives them a reason to come back and engage. So this is just a thank you. We hope that you guys got at least some new nuggets out of this and ways to talk about this information. The slides are available to you, but that's all we had for today. You're welcome to follow us on social media as well.
Hey, thank you guys so much for that great presentation. I honestly, I think before this, I couldn't tell you one single thing about coalitions at all. But now I feel like I can tell you some definitions and I can, maybe start building a multidisciplinary team to try and see how you can get some of those initiatives started. I'm going to open it up to questions, and you're welcome to drop those questions in the chat or raise your hand. I actually did have a question. How would you say that building these coalitions differs in urban areas versus rural areas? Because I know that urban areas usually have a lot of resources compared to rural areas who have just very limited resources. So how does that kind of dynamic end up working?
Yeah, that's a really great question. And Chris, feel free to add anything that I missed. So, my experience is primarily with the rural areas, but I think a lot of people wear so many different hats that they're involved in several coalitions, and their role is maybe a little more broad in rural areas, where I feel like in urban areas, people have a specific role. They serve that role, they do that role, and that's like their job, right? And they go to coalitions and they kind of divvy it up amongst a team, depending on whose specialty is suicide prevention versus mental health versus substance use, right? So they have a team that goes and does those things. But in rural areas, it's kind of all hands on deck. So even, and I think this is true everywhere too, where mental health people will be on coalitions for substance use and vice versa. And I think that it's really nice. But I think one of the things with rural areas is everybody kind of knows everyone. And so we're really interconnected. So it's easier maybe to find the people that you're missing, or the collaborators that are on other things that you're like, hey, join me. But maybe in urban areas, that's not quite so clear cut and as easy to identify everybody, because there's so many things going on, and people are very busy in both areas. So it's just, yeah. Chris, did I miss anything?
No, and I don't work in urban areas either. And so, but my perception of an urban, and I've worked rural for like 15 years. I haven't done urban in so long, is that like urban has so much and rural has so little. And it's, yeah, like Ashley said, all hands on deck. But I do think the thing to mention is like there's like some hesitancy when a new resource comes into the
Yes.
area or new org. like people are suspicious. So it's hard to break into the rural community if you're like a new provider or a new org of some sort. That's when it's tricky getting even invited to the coalition because people are definitely suspicious of new people coming in.
Hmm.
But I did really quick want to say too, I can't remember whose comment it was, maybe it was Lindsay's. I think I've heard from my students in the past, so talking about like getting access to research studies and stuff, that if you guys live near USU or the U or at Eastern or any, I know we only have so many universities, but I've heard at USU, like community members can go to campus and access like the research and things as a community member, and you don't have to pay. Like you just have to go to our library. And I wonder if that's the same for the U and for Eastern. But just, that's another possible opportunity if you're trying to figure out some of the research things. I think the librarians will help you because I know the university like welcomes, because I always tell students like download everything you possibly can or need while you're a student because you'll have access to everything. But a student had told me in the past, like, oh no, as a community member, you can just go and do it. I was like, oh, that's pretty sweet. So I just want to mention that in case it's a resource that is true.
Also, if you're an org that needs help with research, there are a lot of really hungry students that need hours.
Yes, yeah, that's a really good point. And in the fall, I feel like a lot of students have preceptorships and things that they need. Hmm.
And again, everyone, you're welcome to drop any questions in the chat that you have, or you can raise your hand. But while they may be doing that, I actually had a follow-up because, like, as you guys said, it is kind of hard to maybe gain, like, in rural communities, everyone knows kind of everyone, right? You guys are more connected than in an urban area. And as you said, like, maybe when there's a new organization, the trust for it isn't as high. So how would you maybe even go about increasing trust towards like an initiative or a program in a rural area? Like, would it be kind of more on foot and going to the area, or what would that look like?
Yeah, so I think when people have done this well, they actually go and introduce themselves to different organizations that are relevant, right, to what they're trying to do, and kind of finding their collaborators and their networkers and people who are doing similar things and introducing themselves in person. And then I've had people also give presentations at coalition meetings just to bigger groups of people to say, here's, we're new, here's what we do, we want to work with you, and kind of having the open arms, right? Like, we're here, we want to work with you instead of like stealing, like Chris said, right, limited resources. We don't want to like take away from the work that you're doing, but we want to support it and be engaged and involved.
I think also like if you're newer to your profession and newer to the field, let's say I'm just thinking about Ashley and your guys' coalition or like in Emory, I'm thinking about Emory and
Hmm.
some of the stuff Chris used to tell me, but like I think if you can find someone in the community who's a key stakeholder that wants to like agrees with what you're doing and wants to be a supporter, having them like be a speaker or be someone who's really like vouching for you in some ways can be really helpful, right? If they're like the first to join the coalition, like if you can find that trusted, like I used to do work in San Juan, and like I worked with someone from a counseling place, and this woman was all up in everything. And as a result, like she helped us really get in with a lot of the people we needed to do the project we were doing for them. So some of that reputation of like a key member who's from the community, especially if you're new to the community, right? Or new in the profession, that can make a world of difference for you
Yeah,
too.
a champion.
A
Hmm.
champion. There you go. Good job, Ashley. Yeah.
Thank you for that. I've honestly been trying to maybe increase outreach towards rural communities and areas, so I think that was really helpful. I really appreciate those answers. We'll just give it a few more seconds and see if someone does have a question in the chat. I know Lindsay did have a comment saying that sometimes it's really helpful to talk to some of the religious groups or some of the church groups. So
Yeah.
that's a really helpful suggestion. Yeah, for sure.
I think it's interesting though, because so thinking about more of the academic people, when I started at USU, and this I think has changed a little, but we were told like, because in social work, right, we incorporate religion into our practice and religion is very important, but we were told like, don't even try to work with the churches. Like other than like the Episcopal church, nobody wants to work with you. But I think that's changed a lot. And I think in rural communities, it's a lot easier, like versus an urban or like Logan is more of an emerging. We have a million wards, and but I think that the way we think about that in Utah has changed, because like 8 years ago when I got here, everyone's like, don't even, like, they're not gonna even talk to you. So where I think in rural communities, they're like, yeah, let's, we can host that here. And anyways.
Thank you. I think that is a really great point.
And often churches are the only ones doing outreach in the community.
That too, sometimes, yeah. Sometimes situations can just be so differential, but I do think that that was a great suggestion. But I would like to just thank you both, Ashley and Chris, again for your time and your presentation. I really feel like I learned a lot about coalitions. I honestly might join one myself at the end of this Echo session. Let's see if I can find one. I don't know, but I
Do
think you
it.
guys did a wonderful job. I think I will. I think it sounds like a wonderful job. And I just love how it's just people working towards this common goal, and you have a bunch of different people from different backgrounds. And I
Mhm.
just think it's a wonderful thing. So thank you guys again. I will
So
say
before
that
you end, Leo, I'm just going to add my 2 cents. So it's Janelle. I always think that working with your Part C early interventionists is a really important piece, because we have such strong connections to families that we can share resources. Sometimes I don't always feel like we're invited to that table or those conversations, because it seems like it's out of our realm. But so that's one of the things that was my takeaway, like how, as an early intervention provider, do I become involved in that?
thank you, Janelle. And I think that is a really important, that's a key point to just kind of focus on, is that maybe a lot of the times I don't know, like if you come from a certain, I guess, academic background, you may think that you don't have a place at the table, or other people may think that they can't include you. But I think with the idea of coalitions, it's great because you can include everyone, because maybe somebody, or I think everybody has something to contribute. So I think that's a really great point, Janelle.
Mhm.
Our next session is going to be on May 13th. It's going to be about exploring the impacts of substance use on families. I'm having Jill Gresham from the National Center on Substance Abuse and Child Welfare present for May, so I'm excited and looking forward to that one. Also, please remember to fill in that survey for your credit of attendance. Tori has been dropping in that survey link throughout the chat. And again, we just really like looking at the feedback and seeing how we can make these echo sessions better for you to attend. And also, if you would like to access some of the resources from this presentation and from some of our past presentations as well, you can email projectscope@usu.edu for an invite to our Canvas page. So thank you guys.